Good morning. I'm going to do a brief overview of certain concepts in the Chapter 16 treatment of psychological disorders. I wanted to introduce sort of two general areas we're going to talk about, psychotherapy and biomedical therapy. So, psychotherapy is when the psychological techniques that are used to help a person overcome psychological difficulty and disorders. So, I think it's important that the book notes a difference between psychological difficulties and disorders. And we've seen this many times, this sort of distinction of who does what psychology and helps who. So the difference between a social worker and a psychologist or a psychiatrist. So different psychological conditions require different support. And the biomedical therapy is that they rely on drugs and other medical procedures to improve psychological health. So I talked a lot about Freud in in chapter 15. So I'm going to sort of continue this vein a little bit and go through each one of these psychodynamic and different approaches to treatment. So the psychodynamic approach to therapy is working with the defense mechanisms that we've talked about. So the repression, which pushes the threatening and unpleasant thoughts back into the unconscious. And really, Freud just wanted to bring the unresolved conflicts and impulses from the unconscious into the conscious. So we talked about the id, the ego, and the superego in terms of sort of personality. So it was all about what's unconscious versus what's conscious. So in this therapy, it is a very time intensive therapy. The goal was to release the hidden unconscious thoughts and reduce the power in controlling these behaviors. So reduce the power of the unconscious. So they would do free association, dream interpretation. So a manifest content means that they're moving beyond the surface of the description of a dream. The latent content is when they're looking at the meaning. Freud also looked at the resistance. So he wanted to know why these people were not willing to divulge this information. And he was one who defined transference. So the transfer of feelings to a psychoanalyst that had originally been directed to parents of the patient or authority figures or basically anyone who had power over them. So contemporary approaches to psychodynamics contemporary psychodynamic approaches really focus less on the patient's past history and focus more on what's going on in their current life, so their relationships, their complaints, their shorter duration. So the time period of therapy is typically 3 months or 20 sessions, and most insurance companies will only cover 20 sessions. So when we go back and we think about psychodynamic therapy, it's important to think about not only what did the therapy bring to the field of psychology, but how can we sort of think about this critically? And as a consumer of psychology, what do we need to question and what do we need to look at. So the criticisms were that it's very time consuming and expensive. Um, if you think about the patients, the ones who are less articulate, they may not do as well as the ones who are. Um, and there's a lot of bias and subjective interpretation. So this idea of operational definition for professional practices and so forth is not really established there. So it gives the psychoanalyst a lot of power. Okay, so behavioral approaches to therapy, basically, if we go back and connect with this idea of learning and the behaviorist approach, is that reinforcement and extinction, so their interaction with a stimulus, will either reduce or eliminate maladaptive behavior, so behavior that does not serve them well psychologically. So the goal of this is to change people's behavior and to allow them to function more effectively. And there's three sort of major classical conditioning treatments: aversive conditioning, systematic desensitization, and flooding treatments. So aversive conditioning reduces the frequency by pairing that undesired behavior with uh, excuse me, with an aversive stimulus. So a lot of times, the way that electric fences work with dogs, they will get a shock if they pass a certain line. So they learn over time that, or they have one really horrible experience where they sort of get a healthy amount of shock when crossing over the electronic fence, and then they never cross it again. Or that sound was paired with, that shock was paired with the sound, so then they just hear the sound. But the behavior of staying inside the electronic fence is still there. Also, people who are thumb suckers will sometimes, people, and you're trying to extinguish the habit, people will put some sort of pepper paste or something on the thumb so that the child uh, doesn't like the taste. Systematic desensitization is exposure that's to an anxiety producing stimulus like a spider, um, and is paired with deep relaxation. So the way that systematic desensitization, an example of this would be, you think about a spider, then you look at a photo of a spider, then you look at a real spider in a box, then you hold the box with the spider, you let the spider crawl on your shoe, then you let the spider crawl on your foot. And the flooding treatments is similar to its name. It's a flooding of information. You immediately expose someone to a spider, and then you let them sit with that feeling, and then they learn that that intense emotion that they're feeling with this anxiety is not, will pass. Cognitive therapies, they teach people to think in more adaptive ways by changing their sort of dysfunctional cognitions about the world. So they want to change people's thoughts. And the cognitive appraisal is where you evaluate situations, and you do look at their memory. So we do look at their past, like the psychodynamic one, but you also look at their values, their beliefs, their thoughts, and their current expectations. So a really beautiful model of this is the thoughts create. I don't know what the acronym is for this, but basically a triangle of thoughts create feelings, feelings create behaviors, and behaviors reinforce thoughts. So, sort of looking critically at what's going on in this person's head and how can we sort of change it so that they're more functional. And contrary to psychodynamic, it's really focusing on concrete problems. Another example of this is the ABC model, right? So you think about the activating condition. Someone breaks up in a relationship. So that's A, the activating condition. Then they think, oh, I'll never be loved again. And there are emotional consequences. So they're sad, they're lonely, they're depressed. And that B, so the consequences sort of feed the belief system. Humanistic therapy, we've seen this before. It's important to sort of recognize this idea of self-actualization. So the goal is for someone to reach self-actualization. So it's also known as client-centered therapy or person-centered therapy. And I just want to point out the connection between self-actualization and this idea of motivation and emotions. Um, so that in person-centered therapy, there's this unconditional positive regard. So total acceptance, understanding, um, regardless of what the client says. And um, so Hans Eisnick did a study looking at effectiveness of therapy, and he looked at the effectiveness of therapy in contrast to spontaneous remission, meaning someone has a psychological issue and they recover without any formal treatment. And so he did what they call a meta-analysis, where he looked at many different studies and then combined them statistically. And here are the basic findings of his research: that the psychotherapy in general is effective for most people. It doesn't work for everyone. No single form of therapy works best for everyone, so it's not a sort of blanket solution, and that most therapies share several basic elements. So one is sort of developing the bond and the positive relationship between the client and the therapist. The other one is that they're trying to explain or interpret the client's symptoms, and that they're always confronting negative emotions. So this is from the textbook, but this is from a study in 1980, and what they looked at was the success rates of different types of treatment. And what they found was that cognitive behavioral was the most effective treatment, but systematic desensitization was a close second, and psychodynamic. So they're all within a certain range. So around, above 60%, close to 70%, but that cognitive behavioral has the highest success rate. And cognitive behavioral is sort of a nice adaptation of previously or historically used therapy practices. So I just wanted to show this classes of drugs, psychological disorders on here, because I think it sort of gives you a good idea of the different classes of the drugs. So here there's the antipsychotic, and we talked about schizophrenia in the last lecture, and dopamine receptors. And so the effects of the drug is that it reduces the loss of touch with reality. So basically grounds people into where they currently are, and decreases the symptoms of delusions. And so some of the famous names are Haldol, chlorpromazine, and the antipsychotic drugs are different here, but the antipsychotic drugs don't necessarily mean that they're for someone who is psychotic. So a lot of people take SSRIs for a reduction in depression or anxiety, and we talked about the neurons and the synaptic gap. And basically, what they do is they SSRIs inhibit the reuptake of that serotonin neurotransmitter. Um, the mood stabilizers for uh, mental disorders like bipolar, lithium is a very common and sort of important drug in that sense. And there's anti-anxiety drugs, which increases the neurotransmitter GABA. And as we learned before, this is a inhibitory neurotransmitter versus an excitatory one. Like I said, they're the antipsychotic drugs. The symptoms reappear when the drug is withdrawn, and there are long-term side effects. So I think they're called negative side effects, where, and a lot of people struggle with this idea of taking this medicine because the side effects are often, in their experience, worse than the reason that they needed to take the medicine. So there's a lot of the people do not comply with taking the medication. So I wanted to look at something that's sort of local to Western Mass, this idea of deinstitutionalization. So that's basically transferring former mental patients out of the institutions and into the community. And I know that not everyone is in Western Massachusetts, but I will post this so that you can look at it. But basically, what happened is the Northampton Mental State Hospital, which is overlocated by Smith, had this deinstitutionalization. And so a lot of the homeless community that is out in Northampton are former mental patients who just got transferred into the community for community level support. And this was a big thing sort of in the 50s, but in particular sort of from the 70s to the 90s, when medication became a much more viable option. A lot of people who were institutionalized were these institutions shut down. So that's what we have for chapter 16.